Okay, welcome back to PT Meal Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of the physical therapy profession and practice with a Filipino flavor. I'm Johan De La Paz, your host. Thanks for dropping by. So, if you're new to the podcast, could you do me a favor and subscribe to us wherever you're listening from? This podcast is available in your favorite podcast streaming apps: Spotify, Apple Podcasts, Google Podcasts, Anchor, iHeartRadio, Amazon Music, and many more. So you can also catch us in YouTube to see our beautiful faces and subscribe there as well if you want to be in the loop on fresh episodes, updates, interview snippets, research abstracts, or educational materials. Follow our social media accounts in Facebook, Instagram, LinkedIn, and Twitter. And as always, we have an exciting episode for you today. So I have in the podcast a former physical therapist with a truly unique and incredible and inspiring experience. Um, Dr. Eric Anthony Galvez was a physical therapist who was diagnosed with a golf ball sized brain tumor in 2005. A month later, he undergone surgery to remove it. Now he's an active member of the APTA Oncology and in IPT-HOPE, or the International Physiotherapists for HIV/AIDS, oncology, and palliative care empowerment. He also wrote two books about his journey. First is entitled Reversal: When a Therapist Becomes a Patient, and his latest book, Awakening: Becoming a Brain Tumor Thriver. So without further ado, it's my pleasure to welcome Dr. Eric Galvez. Welcome to the podcast, Eric. Thank you for coming to this program. I'm excited to what we're
Yeah.
about to talk about today.
Well, thank you for having me, Johan. This is very exciting for me. Like, I haven't done a whole lot with the Filipino community, so
Mhm,
yeah, I'm actually a Filipino American. So
mhm.
I was very excited when you contacted me. I was like, hey, this is cool. You know?
All right, so I'm so excited to hear about your story because it's really unique. I mean, um, nobody wants to have that happen to us, but things happen. So, could you share to us the story of when you found out that you had you know a brain tumor? You're and how when you discover that, how long of a physical therapist have you been,
Yeah.
and
Well,
what the journey from that to now.
okay. Well, I graduated from physical therapy school at the University of Michigan in
Hmm.
2003.
Hmm.
And it's I was in Michigan and it's cold there, so
Right.
I decided to move to San Diego, California, to start my physical therapy career.
Hmm.
And I worked for about a year and a half, and that's when I was diagnosed with a golf ball-sized brain tumor between the brainstem and the cerebellum.
Hmm.
So it's a very, very dangerous spot, and
Right.
yeah, it was just insane. Like I was having a lot of symptoms of nausea, dizziness, and headaches.
Uh-huh.
And honestly, I just kind of blew it off. I thought I was just maybe, you know, enjoying life too much, I guess.
The
Because
stress.
those symptoms. Yeah, exactly. But yeah, then I started getting facial numbness, and that's when I decided to actually get things checked out because a lot of the symptoms are not normal. So
Hmm.
and what they did, they did a stat MRI like in the middle of the week. I just started working, so I was thinking that, maybe, now that I'm a professional, they're pulling some strings for me. But apparently they found the golf ball sized brain tumor between the brainstem and the cerebellum.
Hmm.
So, as we once knew as physical therapists,
Hmm.
the brainstem is extremely important.
Right.
So, I mean, it had me totally surprised and scared at the same time because, when I first moved out to San Diego, California, like I was very physically active. I was doing triathlons. I was just getting into surfing, and I was running a lot of road races.
Hmm.
So it took everybody by surprise,
Hmm.
because like at the time in 2005, the only time you heard about brain tumor survivors was when someone famous got one, and someone famous passed away from a brain tumor.
Right.
So I was very, very intimidated and very scared about what was going to happen next.
Mm-hmm.
So it was just a crazy thing. And I was 30 at the time, so like, I mean, I didn't have a family yet, so like
Mm-hmm.
I didn't have a whole lot to worry about. So, who do I call? I called, my parents, because like, you don't know what to do in that type of situation. So, my parents are both med techs in here in Michigan,
Mm-hmm.
so they had a little bit of medical background, but at the same time, they didn't know a whole lot about brain tumors or
Right.
even rehabilitation. So I was just in a very weird position because I had to like, explain to them what was going on
Mm-hmm.
while at the same time trying to take it all in and trying to digest how serious everything was.
Right. Was there a sense of urgency once the diagnosis was confirmed?
Yeah, well,
Uh, this
they
is
wanted to do a surgery right away. It took about a month to get myself scheduled uh,
mm-hmm.
for the craniotomy and whatnot.
Mm-hmm.
So there was definitely some sense of urgency because, the good news was the brain tumor that I had was a meningioma, so it's a slow growing brain tumor.
Mm-hmm.
So, we tried to get in as quick as we could. It took about a month well, yeah, it took about a month to actually get onto the operating table.
Mm-hmm.
But again, I was 30 years old, and at the time, you didn't hear a whole lot about brain tumors.
That's
So
correct.
it was
Yeah.
just a very, very scary time in my life.
Mm-hmm. And it's very rare to hear about anyone having brain tumors, especially someone healthy
Yeah,
in the prime of their lives.
right.
So after your surgery, what happened then? Did you start rehabilitating right away?
Well, that was the thing. Like, I treated a few brain tumors when I worked acute care at
Mm-hmm.
the hospital, and I actually had surgery where I used to work. So a lot of my
Oh,
coworkers and
uh-huh.
physicians were my medical team,
Right.
which was kind of awkward at first, but
Uh-huh.
I definitely felt safe. I
Uh-huh.
knew the procedures and I knew the way things ran. But most of the brain tumor patients that I did see, were only in the post-op ICU for like a day or two. I was there for like a week. I was there for
Mm-hmm.
like, I think, s- s- 7 to 9 days. I can't remember exactly, but I was there for a while. Like
Mm-hmm.
I was actually in a medically induced coma for a good 6 days. So yeah,
Mm-hmm.
it was just a very scary time for everyone, especially my family. So
Mm-hmm.
that was what I was most worried about.
Right. Okay. So what were the um impairments that you got from the surgery or from that brain tumor being in that area?
Yeah, well, that was the thing. Like,
Mhm.
the brainstem and the cerebellum. So I've
Mhm.
got a lot of ataxia,
Mhm.
and I don't know if you remember your anatomy, but like,
So
there's
long ago.
yeah,
Yeah.
exactly. But a lot of the cranial nerves are in that
Yeah, in that area.
area. So there's a lot of decussations and crossings. So
Mhm.
I've got impairments on bilateral sides. So I've
Mhm.
got ataxia on the left and intention tremor on the right.
Mhm.
But the like the tumor was actually at the cerebello-pons angle.
Mhm.
So um, a lot of things like your heart rate, your breathing rate, a lot of important basic body functions are in that area. So I was very scared about, you know, number one, about the surgery, and then number two, more importantly, how it was going to be after the surgery.
Exactly, right. So after surgery, after the tumor was removed, um, was being a physical therapist help you with your road to recovery? Were you more, you know, in, active, so to speak? You're the one initiating it because you've treated patients with that underwent that same procedure before.
Oh yeah, being a physical therapist definitely helped.
Um,
I think it was more beneficial for my parents because like I kind of explained to them what was going on, and it kind of kept me level headed at the same time.
mhm,
But as a regular patient, I was freaking out because
mhm,
this is very, very delicate.
mhm,
The brain is a very delicate area.
mhm. Right. And your book was really apt. The title was really apt, reversal from physical
Yeah.
therapist to patient, and now you're on the other end trying
Yep.
to get back to your highest function. So what was the um biggest impact of that experience in your personal life?
Well, it's very humbling. Like, I mean,
Mm-hmm.
I'm the kind of guy that likes to know what's going on and likes to prepare for everything. But, it was very frustrating because, I knew what had to be done to progress, in terms of rehabilitation,
Mm-hmm.
but I was unable to do it. I'm
Mm-hmm.
just now starting to get a lot of function back. So I've looking forward to returning to driving a car again.
Uh-huh.
And then, like, I've progressed from being in a wheelchair to a walker to crutches now,
Mm-hmm.
to one crutch, and I'm starting to walk around without anything.
Okay.
Very slow, but it's been 17 years, but a lot of the impairments have improved at least a little bit. So,
Mm-hmm.
I think we can see more functional gains now.
Mm-hmm. Right. And in terms of your profession, you're unable to your practice now. How was that?
That was honestly that was a
Oh.
very tough pill to swallow because
Mm,
in terms of physical therapy school, you do what 4 years of undergrad, 3.5 years of grad school,
right.
your boards and get your specializations. So, all that went out the window because a lot of my impairments are physical
Mm-hmm.
in terms of balance and coordination. So I couldn't return to work as a PT.
Mm-hmm.
So I ended up, writing a book. I actually writing two books. I ended up starting a cancer nonprofit that focused on, the young adult survivors because,
Mm-hmm.
the young adult cancer survivors are a very unique
Mm-hmm.
demographic. Just because we're not in the pediatric, we're not the pediatric survivors where like everyone's looking out for you, and
Mm-hmm.
we're not the older cancer patients like our grandparents or whatnot. So
Mm-hmm.
we're in that weird space where we're not quite a kid and we're not quite the the
Mm-hmm.
older adult.
Right.
So
Yeah, you're kind of you're treated like an independent person, and yet you survive this experience. Yeah, and those two sets of population at the end are taken care of
yeah.
because they're more, there more needs for pediatrics and geriatrics. Hmm. Um. So how did the experience change your perception as a physical therapist and living that experience as a patient?
Yeah, it's very interesting you mentioned that because
Oh.
as a physical therapist, you work what 8 hours a day, go home,
Mm-hmm.
do your own thing. But
Right.
as a patient, your impairments are with you all the time, 24/7, 7 days a week. So like, that's just something that was very, very like I mean, at 10 or 11 o'clock at night, if I have to get up and go to the bathroom or go get something to eat,
Mm-hmm.
I still have those impairments there.
Mm-hmm.
So it was just very eye-opening. And just going out in public, at first when I was in the wheelchair,
Wow.
you know, think I don't know if a lot of physical therapy students do this, but there's patient simulations that a lot of classes used to do. I don't know if it's accurate anymore, if they still do that, but like being in a wheelchair,
Mm-hmm.
just experiencing how people respond to you,
Mm-hmm.
and it was just very eye opening.
Mm-hmm. Yeah. In school, I remember trying to role play as as a patient in a wheelchair, but that's short term. You
Yeah,
just do that for 10 minutes or so,
right,
doing
right,
being a patient and being assessed and stuff like that. But you're actually there, living it. And um I don't want to I don't want to compare my experience to your experience, but having a condition that your patient complaints about, like for example, if I had a severe back pain before, it was from sciatica, and it gave me a different perspective and um what do you call it, appreciation on what patients are telling me. And I guess that is same with you, having being in that situation, that you're living it
right.
as a patient. So you mentioned about creating a nonprofit.
Oh yeah.
Uh-huh. So can you tell us about that?
Yeah, it was very interesting because
Uh-huh.
like, at the time, we were talking a little bit earlier about the young adult cancer survivors.
Mm-hmm. Yeah.
It's a very neglected demographic. And
Mm-hmm.
I went to a couple young adult cancer survivor conferences, and I got to meet some some people from like the Live Strong Foundation way back when it was when it was very active.
Uh-huh.
But yeah, it inspired me to start something specifically for the newly diagnosed. And
Mm-hmm.
one of the main things is that when you're diagnosed with cancer or some other disease, you want to find people that are like you, and you want to hear about their experiences. And that was something that I wanted to organize and
Mm-hmm.
just kind of help people feel a little bit better about their situation.
Mm-hmm.
So we like the nonprofit that I started, it was called Mass Kickers,
Mm-hmm.
and we de-emphasized the M, so we were ass
Ass
kickers.
kickers.
Yeah, because I figured a lot of cancer nonprofits, they took at the heartstrings of
Mm-hmm.
people, and I wanted something a little bit more empowering, something with a little bit of attitude. So
Mm-hmm.
it's very subtle, and that was just something that I felt like there needed to be just more of a fighting attitude, or especially towards cancer. So,
Mm-hmm.
that's why we started it. And it was kind of cool because, we actually took survivors to other parts of literally other parts of the world to talk about a proactive life after cancer.
Mm-hmm.
We went to the Philippines, we've
Mm-hmm.
been to Japan, we've been to South Africa, Belgium,
Wow.
and of course, Canada. So
Mm-hmm.
like, we did a lot of traveling,
Mm-hmm.
internationally, and then COVID hit,
Uh-huh.
so
Oh, that
we had
stopped
to
you.
shut down the nonprofit.
Uh-huh. Gotcha. But yeah, it's raising awareness on that topic of cancer that hit young adults. um I mean, if we talk about cancer, not many people would think about young adults as a demographic
Yeah,
for it. you know People who are just starting their lives, being pick up their health, and then getting that cancer. Aside from that, your nonprofit, what are the things that you do now with the APTA Oncology and IPT Hope?
oh yeah. Well, with the APTA,
Mm-hmm.
I'm actually the membership chair for the Balance and Falls SIG. Now, I consider myself a retired physical therapist
Mm-hmm.
now, so I'm not actually practicing,
Mm-hmm.
but I still feel like I can add a lot of input into what the direction the Balance and Falls say is going in.
Mm-hmm. Yeah.
We actually started um, a program with the we incorporated a program from the CDC. It's
Mm-hmm.
called the Steady.
Steady. Mm-hmm.
Yeah, it's a balance assessment,
Mm-hmm.
a community balance assessment. So we tried doing that last year with oncology patients,
Mm-hmm.
but again, the COVID thing
COVID.
kind of made things difficult.
Uh-huh.
So this past October or September, we collaborated with the APTA Geriatrics and the
Mm-hmm.
Academy of Neurophysical Therapy.
Yeah.
So we did a lot of like social media posts, and we tried doing some balance screenings also. So
Yeah. Yeah, I heard
really
about that.
trying to stay active in.
Right. I'm a member of the APTA Geriatrics
Oh,
Fall as
okay,
well. So I heard about the collaboration of neuro onco and
okay,
geriatrics
okay.
and falls, and you're really in a unique position to you voice out your perspective and insight about that since that how about tell us more about IPT Hope
Well,
because
yeah,
mm-hmm,
it's an international organization.
mm-hmm,
They have a conference every 2 years. I think this coming uh, fall it's in Dubai,
mm-hmm.
or no, it's in the spring, but it's actually in Dubai. So a lot of physical therapists from different countries. Are you familiar with World
World
Physiotherapy?
Physio, yeah, formerly World Confederation of Physical Therapists.
Yeah,
Mm-hmm.
yeah, I think that's right.
Mm-hmm.
But yeah, there's a special interest group that focuses on HIV/AIDS, oncology, and palliative care.
Mm-hmm.
So it turned out one of my professors from physical therapy school is the director
Mm-hmm.
of IPT-HOPE.
Mm-hmm.
And I asked her if she needed any help with anything. And, I was kind of the nerd in my physical therapy class. I created a website for our class,
Oh,
before this was before
before social media.
media. So, yeah. So she was like, yeah, we could definitely use help with our website. So,
Mm-hmm.
if you just go to ipthope.com, I
Uh-huh.
put the whole thing together. So,
Oh wow, that's amazing. All
yeah, but
right.
it's been very interesting. So, I mean,
Mm-hmm.
yeah, it's so cool meeting therapists from
Mm-hmm.
other parts of the world.
True,
I'm
true.
really enjoying it.
Mm-hmm. And you get to practice. I mean, practice so to speak, what you've learned and share your unique insights there. So with this, whole journey, your whole experience, what lesson have you learned that other physical therapists can learn from as well?
Well, first off, I think that, you got to remember that the patients that you meet and the patients uh, that you're working with are humans, and
Mm-hmm.
you got to realize that, especially when they're being kind of di- disagreeable.
Mm-hmm.
So there's definitely a reason why they're being difficult or whatnot. So,
Mm-hmm.
I think that that's the main thing. You got to just remember that there's a human side to the patient,
Mm-hmm.
and you just got to remember that, like, there's always a way. Like, one of the things that they really harped on us in physical therapy school was, functional goals. And I
Mm-hmm.
think occupational therapy does a great job of this. But, find out what your patient really wants to do, and
Mm-hmm.
what their goals are, and just apply that to whatever exercises or walking goals that you have.
Mm-hmm.
This is where I think I enjoyed physical therapy the most, was being creative.
Uh-huh.
Use that creativity to, make your sessions more enjoyable for both the patient and for you.
Mm-hmm. So that this added motivation
Yeah.
in the session. You mentioned about looking at the human side of patients. When you were in therapy, have you had that experience of oh, this is what my patient was talking about? When you're doing the PT for them. Have you had that like aha moment or epiphany?
Yeah, well, one of the things that, like, I like to think that I wasn't a difficult patient, but
Uh-huh.
looking back on things, I think I might have been,
Uh-huh.
just because like I knew the therapist very well, and I knew the procedures in the hospital. So
Uh-huh.
I used to like to give everyone a hard time. I would pretend to fall and
Uh-huh.
whatnot.
Yeah.
If you can't tell, I'm kind of a goofball. So like I like to joke around, but
Uh-huh.
yeah, like I think you know I don't think that people didn't like working with me, but I think I could have been difficult at some time.
Yeah,
Oh, I've got some therapists that work with me though.
were you working with your former coworkers? Oh,
Yeah,
okay.
these are the people I used to go to lunch with. These are the
Uh-huh.
people I used to go to happy hours with. So,
Uh-huh.
like,
Uh-huh.
there's definitely a relationship before, the
Before that
actual
habit. Uh-huh.
PT patient relationship. So,
Uh-huh. Yeah.
definitely a strange situation.
Uh-huh. Right, right. I can imagine. I think for me, if I become a patient, might be a little difficult because I like to say things.
Yeah,
So, but I would be stubborn as well.
yeah.
Um, for since we're trying to educate also those who are have survived the experience, what do you want to share with any brain tumor survivors that might be listening to our episode today?
Yeah, well, that's the thing. I think if you really want to do something, you just have to be creative.
Mm-hmm.
Like I think, and anything is still possible. It's just it might not be exactly the way that you think it's going to happen. Like
Mm-hmm.
I really think if you really want to do something, there is a way to do it.
Mm-hmm.
It's just you have to figure it out, and that's always been the fun part for me. I always love solving puzzles.
Mm-hmm. All right. And what helped you with, in this journey, aside from being a physical therapist, what other things outside your control was able to, assist you in this journey of recovery?
Well, honestly, I think it's all about family and friends.
Mm-hmm.
They were, uh, at times kind of annoying, but
Mm-hmm.
at the same time, I knew they were looking out for me. So,
Mm-hmm.
I think that support system is extremely important.
Mm-hmm.
I think uh, a lot of times some patients don't have that.
Mm-hmm.
And I think just being Filipino in general, that the family structure is very strong. So I
Mm-hmm.
think that definitely helped.
Mm-hmm. Gotcha. Support system is really important when we're going through that. Um, you've been I know you've talked to a lot of like events already and shared your stories. You may have answered, different questions from that uh engagement, talking speaking engagement. What questions do you wish people would ask you that not many people would, you know, take time to ask?
That's a really great question. Like
Mm,
I think like when I speak, like I do a lot of speaking engagements to
mhm,
physical therapy programs.
mhm,
So I love speaking to students because they
mhm,
always keep me on my toes, and
mhm,
I'm the kind of guy that'll answer anything.
mhm,
So I've gotten some pretty interesting questions. Like I mentioned to one of them or one class that I'm kind of a dork and I'm a Star Wars fan. So we had this really long discussion about like which is the best Star Wars movie. So
oh.
which by the way is I think Return of the Jedi, but people don't agree with me. So but yeah.
Mhm.
But
Okay.
I'm sorry I got off the what was the
That's all
question?
right. Oh, question that you wish people would ask you that not many people would ask or may forget to ask.
Oh yeah, yeah.
Mm.
Like one of the things that really got on my nerves at the beginning was like when people would assume that I couldn't do anything.
Mm.
Always ask someone before you do anything, before you help someone out. Ask them if they want help instead of just doing it. Like standing up. Like I had this big. I think I went to like some restaurant, and this was when I was in the wheelchair, and I was trying to stand up to reach something, and some big tall guy just came over and picked me up, and I was like, "That's okay, I'm all right." But
Mm-hmm.
you know, I understand being helpful, but
Mm-hmm.
at the same time, you need to respect their space, and
Mm-hmm.
you know, ask them if they actually want the help. So
Right. Because sometimes we tend to see people with conditions as a weak or unable to do some stuff, so that's why we go ahead and help. But in truth, they want to do stuff on their own
right,
and
right.
be. So talk to us about your books. You started the first one you wrote 2 years after uh you had your diagnosis and surgery, and the latest one was uh you made it 2018. So talk to us about those two books and what made you write them.
Yeah, well, honestly, the first book is called Reversal:
Mm-hmm.
When a Therapist Becomes a Patient.
Mm-hmm.
And I remember reading those books that we had to read in physical therapy school, and I couldn't relate to them at all. And
Mm-hmm.
the whole time I was going through everything, I was keeping a blog. I don't know if people still do that, but yeah, I just decided to share certain blog posts as a book.
Mm-hmm.
And I don't know how I did this, but I got my mom, my dad, my brother, my friends, and some of my physical therapists who actually were my friends also,
Mm-hmm.
to contribute essays to the
Mm-hmm.
book on what it was like to have a colleague or a family member going through all the trials and tribulations of having a brain tumor survivor.
Mm-hmm.
As just to kind of give everyone an idea of what the family is going through or the
Mm-hmm.
friends are going through when someone young has to go through something devastating like a brain tumor diagnosis, and it's very applicable to other young patient demographics.
Mm-hmm.
So
Gotcha.
that was my first book, Reversal.
Mm-hmm.
The second book was called Awakening, and
Mm-hmm.
that's just basically again blog posts of when I decided to start my cancer nonprofit.
Mm-hmm.
So yeah, I know a lot of people, uh, feel inspired by, starting their own organization, but this is just talk. This book just talks about how I did it. So
Mm-hmm.
that's what the second book is.
Mm-hmm. And I love the part that the title, which is when you included Thriver, because some people would just be say that okay, I'm a survivor and that's it. You want people to thrive
Yeah,
after that, and it's nice.
it's pretty interesting too because uh, in the first book, like I had family members contribute essays, and
Mm-hmm.
in the second book, I had a lot of my cancer survivor friends
Mm-hmm.
submit essays as well. So
Mm-hmm.
you can kind of get their perspectives on everything, and I asked them to tell their stories.
Mm-hmm.
So it's a very interesting perspective on things.
Mm-hmm. Gotcha. And not many people can have that platform avenue to share their experiences, and this would be a good what do you call this book to share to to your patients or to you to any physical therapist to know more about what their patients may be going through. All right. So, Eric, thank you for coming over to the podcast and sharing to us your experience being a physical therapist and being uh a patient, then an advocate for everyone who's gone through that experience. And thank you also for sharing us your books that our audience can uh, look at. They're available in Amazon, Kindle, and paperback. I think, right?
Oh yes,
Mm,
yes, that's
Kindle.
right.
All right, but before I let you go, I have my last three questions for you, which I usually close with all my interviews. My first last bite, my first last question. What's your recipe for success?
Success. Perseverance. Like
Mhm,
no matter how hard things come at you, like as long as you persevere and just stick with it, you can still accomplish anything. You can accomplish something. Might not be quite what you're looking for in the end, but you move forward.
mhm, right.
Just don't say so.
Just persevere. Right. The second last bite is what do we need to do to move the profession forward?
Well, honestly, I think actually I'm kind of addressing this in
Mm.
the APTA oncology balance and fall seg. I
Oh.
think we need to reach out to the community more. I
Mhm.
think that a lot of people still don't know what physical therapy does.
That's
So
true.
I think there needs to be more outreach and more community outreach and more visible physical therapists doing things out in the community. Like
Mhm.
there are good therapists that get a lot of referrals from physicians, but I want there to be great physical therapists out there doing stuff and treating patients. So
Mhm.
it's going to take a lot more effort.
Mhm.
We're going to have to reach outside of our professional comfort zone.
Mhm. Right. I agree with that. I mean, it's far too common that people would say that physical therapists are not known or not marketed as other professionals. If you have a problem with your foot, go to a podiatrist. If you have a problem with your teeth, go to a dentist. But where does physical therapy come in? Not
Yeah.
many people know that we can do a lot. So yeah, I agree with you with that. And my last bite is, what are the three ingredients? It can be a quote, a statement, a quality, a virtue that you carry with you each and every day of your life. Or in short, what are the three things essential to or that make up Eric Galvez?
That's a really great question. I guess first off, I would just have to say that there's always a way.
Mm-hmm,
You have to persevere and you'll figure it out.
mm-hmm,
There's a way to do anything. You just have to figure out what that way is.
mm-hmm,
You know? And second is just perseverance.
mm-hmm,
You need to keep working at something to make it successful.
mm-hmm,
I think you know a lot of people just give up after the first time they fail. I think if you just persevere, that's something that's extremely important. I think that perseverance is a key ingredient in everything. And the last thing I would say is don't be scared to try new things.
mm-hmm.
Um, like for me, like when I was going through my rehab, I tried hippotherapy, I tried aquatic therapy, I tried
Wow.
I tried yoga.
Uh-huh.
So like I tried a lot of different things. I mean, you can't be scared of trying new things.
Uh-huh. Oh
You might
wow.
you might open your eyes up to something. So
Mm-hmm. So you did try a lot. Like I like hippotherapy, riding on
yeah,
horses.
yeah.
Gotcha.
Wait,
So
I
yeah,
was just gonna say
yeah,
with
sure.
the hippotherapy,
Uh
I found out I don't like horses, so you can scratch that one off. But but yeah, the little kids, I think it works great. But for me, not my thing. So
uh-huh. I read about that even before physical therapy school because we were doing I don't know, a report in English or something, and I saw hippotherapy promotes relaxation for kids with spasticity
yeah,
because of the moving
yeah,
motion of the
okay,
horse.
yeah, yeah.
You didn't enjoy that.
I did.
Was it relaxing?
It wasn't relaxing. Number one, they smell. So it's
That's
like
true.
I couldn't relax.
Uh-huh.
It's just like I don't want to fall off. So,
Uh-huh.
but
Uh-huh.
yeah,
Yeah.
not for me.
Kids enjoy it more because big animal. That's it. That's
Exactly.
what they see. All right.
Yeah.
So I like your last bites. There's always a way, perseverance, and don't be scared to try new things. So there's always hope and a way to solve problems. Yep. All right. Um, if anyone is listening to watching us in this podcast and they wanted to reach out to you, how can they reach you?
Well, I'm pretty active on social media.
Mm-hmm.
So Facebook, Twitter, Instagram, I'm just figuring out, and TikTok, I am just starting to figure that
Oh, you have
out.
a TikTok, huh?
Yeah,
Yeah.
I'm still learning, but
Uh-huh.
I do understand it's more for the kids, but I thought I'd give it a try.
Uh-huh.
So yeah,
And you're
figuring it.
still active in your YouTube channel.
Yeah,
Mm-hmm.
and YouTube as well.
Mm-hmm. Are you still continuing your blog? Because I think that's where I first read about your story.
Uh, Honestly, not really.
Not at
I've been
all.
experimenting with YouTube and video blogging,
Mm-hmm.
so I've been doing that more frequently. But
Mm-hmm.
I don't think I don't think I've posted a blog
Mm-hmm.
in a
Oh,
very
wow.
long
Wow. Gotcha, gotcha. All right. Again, Eric, thank you very much for coming to the podcast. As a takeaway to our audience, our listeners and our viewers, what is that one thing that you want them to carry to their practice once they come into their work that come in hearing us talk about your experience?
Well, the biggest thing for me is that you got to understand that the patient that you're seeing is not just a total knee or a total hip or you know a a back patient. That there's a human being there. And
Mm-hmm.
if they're acting like a jerk, there's probably a reason for that. So
Mm-hmm.
you need to kind of like dissect, why they're doing things, why they're acting a certain way. But you got to remember that they're probably just having a bad day, and everyone's human.
Mm-hmm.
And you really, I can't stress enough. Like I think PTs, OTs do a really good job with this,
Mm-hmm.
but we develop relationships with our patients, and I think that honestly, I think that's what separates us from everyone else. We develop that rapport.
Mm-hmm. Right. We get to really know our patients
Yeah.
to be able to provide that quality care that they deserve. All right. Thank you very much, Eric. Thank you very much, everyone, to listen and watch us in this episode. Catch our next episodes, and make sure to send Eric your support in his social media. All right. Thank you very much, everyone. Have a good day.
Thanks.